And so you know that, of course, as referral center, we have to think about personalized medicine. And for that, we need to have a very good characterization of the disease and to treat it specifically. So at the beginning, we have patients who may be different, but they have all in common an inflammatory phenotype. So when we are at this stage, we try to identify patients that look like together into a disease, and we make some classifications. If we can go and we can identify an autoinflammatory phenotype, at this time, if the pattern of the disease is Mendelian, we can make a genetic diagnosis. If we have a genetic diagnosis, we can do functional research, functional testing, and this functional test may allow to better identify the pathophysiology of the disease. And if we identify the pathway that is related to a disease, so we can, at this time, develop specific treatment. And this is one aspect of the Immunon project. In other cases, we have clinical phenotypes which are related to autoinflammation, but the disease does not appear Mendelian. It's quite more multifactorial. So it means that we have not one gene, we may have several genes, and even we have several genes, there are other factors. And for this, the genetic diagnosis is quite impossible or quite more difficult, but we can identify the gene which participate to the phenotypes and their proteins. We can also study their interactions, and after, by this way, progressing to individual treatments. And this is also one aim of this very important Immunon project, the IMMUNET project. So we can see that all this needs coordinated efforts, different specialists, different discipline of medicine, immunology, and so I think we are really on the good way.